welcome to Informed and Empowered, our Women in Innovation in-person event this year. We are a nonprofit that is focused on bringing women into the space of innovation. And we have a few slides on that you will see in just a second. Our overall mission is to increase the impact and influence of women in the innovation areas across a variety of industries, especially in San Francisco. There can be so many different things. So it's really awesome to see people from all over in the space today. And so in our ideal world, we'll be building a space for women to really thrive and grow in their professional and personal lives. There are about 5 of us on the leadership team. You'll get to see them in just a bit. But overall, what we wanted to share on the screen is that beyond doing in-person networking events, we also host a weekly podcast as part of our global organization. We do an annual gala at the end of the year, award event, and also have a number of community exchanges, both online and in person. And so this is our San Francisco chapter, obviously, but we also have New York and London and everywhere in between. There we go. So the way that we're achieving this mission is focusing on our 4 C's here, capital, cloud, command, and overall community. Because the first three can't be achieved without having the support that we need across all of the areas of your life. And so you can keep going through these because you just talked through some of them already. And as you can see here, not only do we have the women in this room, but there are over 500 of us across the world, and even more subscribers to the podcast beyond that. Like I said, here is the full team, and actually we have our newest member, Marie, so welcome Marie. I will pass it over to Juji to introduce the event tonight.
Perfect, thank you, Laura. Welcome everyone. I'm not only part of the Green SF team, but also part of Koesterer. I'm a senior strategist here focused on designing employee experiences for our clients. And with that, a big shout out to Koesterer and hosting us here. Well, I guess I'm biased, but it's a beautiful space. Probably you have observed it yourself as well, and have seen it in articles as well previously. But what I wanted to share with you a little bit is why are we organizing an event about women's health? For starters, I don't know if many of you knew this, but this month is Women's Health Awareness Month. So it's one of the reasons. The other reasons is because we are hosting every month Coffee Connect, where we're chatting with our community and learning about what they are interested in. And one of the topics that came up in a recent conversation was to talk about women's health and all the things that we typically don't talk about. And then the third reason is that we as a team had a hunch that there's something here. There's something more than just it's a fancy topic or whatever. And as we began actually to organize the event, we started to run across with interesting facts like women are more likely to experience serious migraine than men, or that when you are living in sync with your cycle, it's more likely to have a better impact on your energy level, or similar facts like this that our lovely panelists will talk about. So I hope you will enjoy this event tonight, and the call to action here that I would like to encourage all of you is to let's talk about women's health more and think about how we design for it, either in the physical environment, services, products, or others. So welcome and hope you will enjoy. And now we'll pass it to Ro, who will introduce herself. She's our moderator. And we'll sit at the same time. Thank you.
Hi everyone. Welcome. We're so excited to be chatting with you today. I will start with an intro to myself, and then I will hand it down the line to do your own intros. But my name is Rosana Rabines. You can call me Ro, either way. And I lead the impact investing sleeve of a global family office focused on investing in women's health. And I will be your moderator today. So we'll start by asking the panel to please introduce yourself and share a little bit about what brought you to this space.
Thank you. I am Allison Lewin, and I have a company called Menowar. I do menopause coaching and education. I'm also affiliated with a UK company called Over the Bloody Moon, which does B2B education in the corporate environment, because menopause can have a very deep impact on women in the workplace. So we want to make sure that when we get the support they need, and companies are equipped to help them thrive during this time of life. And the reason why I got into women's health, I spent over 25 years as a marketing leader and corporate executive, had a great career, and then menopause hit me hard. And I was very unprepared for it and felt there was just a huge gap in terms of connectivity with women, doctors who didn't know really how to treat women in menopause, and just saw there was this really big need that I wanted to help fill, and I wanted to have more purpose in my life. So started my company and got very involved in women's health, and it is a great, really interesting and exciting time to be in the space. Just was on. Did you guys hear okay?
Yeah. Is this on?
Yes.
I'm Sonia Koesterer. I am head of service experience at Haven, and it's a headache and migraine center. So we do virtual care for migraine. Migraine affects more women than men, as she talked about earlier. In fact, out of 40 million Americans with migraine, 30 million of them are women. For me, getting into women's health was a little bit less about women's health specifically and a little bit more about health equity and health access. So this is my 5th early stage startup. Over the last 10 years, I've been very focused on healthcare and either working with Medicaid beneficiaries or with the elderly population, or doing chronic care for folks that have difficult access to manage chronic conditions. It's been about connecting people to better care, filling in those experiences. And it just so happens that women are an underserved population when it comes to health care. There is not as much research, there's not as much funding, there's just not as much of providers believing women and believing that their problems are real, so they're really issues to get care.
Hi, my name is Parvatiyar. I'm the co-founder and CEO of Ananya. Hi, co-founder is also Kang. We are a medical device company that builds a tool to freeze abnormal tissue before it becomes cancer. I came to this work as a medical device engineer by training and started my career at a big medical device company in the R&D department. Did that for 5 years and then took a bit of a left turn and moved to West Africa to work in public health. It was only 63 months. People like it. I ended up staying for 3.5 years, and as part of that, part of my work there, I was in clinics relatively often. And every single clinic I would walk into, there was always a room. It did not matter where I was in the world. There was always a room that I would call the equipment graveyard, where all of like the broken IV pumps, the number of vaccine fridges, whatever it might be, that got plugged in once, got used for a month, and now, blew a fuse and can't be used anymore, or they don't have a consumable, and there's no way to get it. So I really came to this work out of a passion for health equity, similar to what Sonia was saying, and access. And as an engineer walking into those rooms, to me, it was always a design problem. It's not, we always think of global health as a cost problem. Sure, everything can be a cost problem, doesn't matter where you are in the world. But from an access perspective, devices really don't get designed to do what they need to do in the places they need to do it. So a couple of years later, WHO made a big priority statement about cervical cancer, and one thing led to another, and we started about a month in 2020.
Hello everyone, I'm Sylvia, the CEO and co-founder of Mira. So my background is the biomedical engineering from Korea, and then I'm here from Cornell, and I was working in a very big company to managing like a business unit for about $100 million. And then at the time, I realized many women at my age started to have a family, tried to have a family, was having a really difficult time. So it's either we being sent to a task-based OPK, or it's like you're you're like unexplained infertility. So doctor can't really tell what's happening with your body or what you can do. So they send you directly for IVF. So at that time we started, Mira, because we want to give the consumer more education and also more women's health data to understand our body. So Mira is we started as a medical device. It's the hormone testing at home. So we test all the female hormone quantitatively. You got the results right there at home. You don't need to ship it anywhere to the lab. And in our app, you can see your chart, your pattern, and then you can see what you do. And gradually we developed the doctor dashboard too. Now we have a lot of doctors working with us too. So we launched this product in 2019. And the company has been growing really significantly. I think we're just lucky, and we also built a fantastic team. And so we're like doubling, we're 70% growth almost every year. And we have gone through a lot. We doubled FDA because we're a medical device, and we built our own manufacturing. We explore multiple markets, go-to-market strategy. We have a fantastic marketing team, and now we have more than 130,000 users, mostly in the US, and we have a lot of data. We have more than 13 million hormonal data at our backend. So now we also have more than 500 doctors working with us to recommend Mira, and we're expanding to consultation, coaches, and also different stages of women's health life, like menopause or PCOS or hormone imbalances. So we have really done a lot. So today I'm very excited to be here to share with you any information you want to hear, and also like to learn from other panelists and have a great conversation. Thank you.
Thank you guys so much for being here. We're really, really excited to bring you this panel. So to start us off, I think everyone's health journey is filled with unexpected surprises, some good and some bad, and we've already started to hit on some of the gaps in your healthcare journeys that you guys have learned over time. But maybe as a starting question for everyone, I would love to ask, what's one thing you wish that everyone in this audience knew about women's health?
So mine is clear. Know about your menopause before it happens. Again, I think people have the wrong idea that menopause happens to people in their 50s and 60s. The average age at which menopause hits is 51, but perimenopause, the stage before menopause when you start to have symptoms, happens often 5 to 10 years prior. And there are women who are in their 30s, early 40s, who are having menopause. And I think so many women are unaware of the symptoms and the signs, and they think they're going crazy or they have a horrible disease. Their doctor's not cueing them to really say, hey, this could be early menopause, or you're in the midst of menopause. So it's more just having this information in advance, and the audience is, I think at the age where, gosh, if you're equipped with this information, you're aware, there's so much out there you can do proactively to manage your lifestyle, make really good choices, and therefore have a much better menopause experience and get the medical attention that you need if you need it. So it's knowing about menopause, how to find the doctor that's suited to treat you during menopause, and all the changes you can make to live a healthy life and thrive.
I think for me, when you look at society as a whole, right? Like in some ways we're very much waking up to the ideas of just women's equity in general, right? Like, and we made a lot of progress. We have a long, long way to go, but 50 years ago we couldn't get a credit card on our own, so that's progress. But when we look medically, like, while it's great that equity is not equal the same, right? Medically, we are not the same, and it's very dangerous if we don't recognize that. There are diseases that only affect women. There are diseases that only affect men. Where there is overlap, they affect men and women very differently. They're biologically different. There are 3 times more women than men that suffer from migraine, from autoimmune disorders, from heart disease. And like in the case of heart disease, it was previously thought of as a men's disease, but it's more prevalent in women. And where there is overlap, they also show up different symptoms. For example, like many women that experience heart disease don't necessarily present with chest pain. The burden of these diseases is different. So, an example for migraine, menstrual migraine can show up with more pain than other types of migraine. It can also be more difficult to treat. When you do find treatment, it might not be quite as effective. It might take it down a notch rather than eliminate it, right? So these things are different. In the case of heart disease, the American Heart Association found that when women go to the ER with symptoms, they're actually in the waiting room 29% longer than men. Also, they're twice as likely to also be diagnosed with mental disorders. So, not the same. We have a long way to go in equity and listening to women in general, but also just it's important to always study those differences so that we understand what we're looking out for.
Plus one, everything Sonia said. A lot of what I have to say is about the data and how little of it is collected for women and how that perpetuates and continues to make the playing field unequal. The one thing I will add on, just so I don't repeat everything, just plus on everything Sonia said, women make most of the healthcare purchasing decisions not just in the United States but worldwide, and it is not the healthcare system is not designed to listen to them, despite that fact being true and having been true for decades. I think women's health, I think we're starting to see a lot more interest, whether that interest translates into sustained funding, whether that interest translates into sustained service delivery, listening to women, that is yet to be seen. But I think we're starting to wake up to the idea that this isn't just about doing something that needs to be done because it's good for the world. It's also good business to be in women's health, listening to women, and particularly in the healthcare space, not just for their own healthcare decisions, but for their families as well.
Yeah, I agree with everyone said. And I think one thing I want to add is I think it's a time right now that we have a lot of opportunities in women's health. So you guys are here, I assume you either are working in women's health or you have the passion and you want to work in women's health. So when Mira just started, we started already about 2017, 2016. We never had English like this, and we never had a community to talk about women's health or what. And I don't think it's a new term. And when you talk with investors and you have to explain to male investors how cycle works. And the only value is that if their wife had a problem to get pregnant, if not, there's no problem at all for any woman in this world. So that's seriously, it's like that. So but now I think it's very different. Along the way in the past 4 or 5 years, there's many events like this where you raise much social awareness, I think. And also along my journey, my personal journey to build this company, I realized there are so many pain points in women's health and nobody is addressing. Like when you think about it, really like specific area, for example, trying to conceive, and you may be confused by your hormone testing, maybe you don't have any pregnancy, maybe you got a miscarriage, you got bleeding during your pregnancy, your delivery had a complication, breastfeeding is difficult, and doesn't mention about how to plan your life, mental health, family decision, all based on that. And the same thing happened with other stages, like hormone imbalances, or even trying to avoid pregnancy, or like menopause. So if you go to each, the specific needs from the customer or from whatever patients, you see there's a huge opportunity. So I think now really it's a fantastic marketplace. If you guys want to do something, it's really the best timing, and there are many things to be addressed. But this doesn't make it really easy, because on the other side, what I also have seen is like many things don't have previous example, so you don't have the set path to follow. We always try to learn from competitor or other industry, and we always have to go to other industry. We have to bring example when we talk to investors. Say this is comparable. It's like that company within maybe male health industry or some cardiovascular industry. They're not exactly the same. So that means you have to probably spend money and time to explore, and you will get trial and error, and you will have to pay that cost as well. But this industry needs pioneers like us. I think still in early stage for this industry needs pioneers like us to get those things done, so this can catch up and eventually become an equal space with other healthcare industry.
That is a perfect segue to our next question. Thank you for teeing me up like that. As you mentioned, there is a huge historical gaps in the availability of data, and we know that that affects women in our own healthcare journeys. But I'm curious for Sylvia and Anu, as you started your companies, how did you think about navigating the gaps in data as you iterated on your solution to find kind of your product market fit?
Yeah, we have the benefit of working in cervical cancer. Is I would say a little bit more well understood than a lot of the others. Ovarian, for example, takes 5 to 6 years to diagnose, and that's the average. That is terrifying. Cervical cancer, at least, since the 1960s, we've had pap smears, we have not genetic testing, we have HPV DNA testing available, we have psychology. This is sort of a well-established medical practice. And yet, did you know, cervical cancer is the 4th largest cancer killer of women in the world. It is the only cancer that is detectable before it becomes malignant and treatable in that pre-malignant stage, preventable with a vaccine, and yet still the 4th largest cancer killer of women in the world. It's an insane statistic to say. We haven't seen as much progress as we would have liked, and hence I mentioned WHO earlier on. That's just one example. We look at the rates of prostate cancer and the outcomes of prostate cancer between 1970 and now, and cervical cancer between 1970 and now. And the outcomes for prostate cancer have improved dramatically. Survival rate, 5-year survival rate is around 90% for prostate cancer once you've been diagnosed. For cervical cancer, that is still covered at 56%, and it has not changed since the 1970s. So while the product that we are developing is relatively straightforward and follows sort of clinical practice, we're surrounded by examples of we're a treatment company. We're relying on diagnosis pathways, for example. A lot of that data just has not been explored. We just don't even know what we don't know in so many cases. And I say that in a really well understood field. Just can't stress that enough.
Yeah, exactly. I agree with that. So when we started, it was also very difficult too. So I still remember I tried to do some VOC at a very early stage before the product launch. I talked with the OB/GYN here in a public hospital. It's a lady. I told her that now we can give the patients so much qualitative data. It's continuous quantitative. You can see that too. How exciting that! And she said, I will hate that product because this will be consuming so much data. They will ask me all kinds of crazy questions that will increase my workload. I just don't want them to see that. So that was the mentality at the time. It's very amazing to hear that today. You say, oh my gosh, how can you see that? But that was, I think, a pretty general mentality actually for public hospital, which is majority of people will go to when you have an OB problem, right? So your OB just think like that. So when we started, we realized that, and so what we did was say, as a startup company, you always have limited resources. So what we did is that we go from some market segment that's relatively easier to be accepted. So that's why we chose to go directly to consumer, because we knew consumers were already trying to use OPK to detect ovulation, and they're not happy with that. So how can we educate them? How can we tell them, bring them a solution, convince them to say, this is what you need, it's much better whatsoever. And we did that. And obviously, all your team, like R&D, quality, marketing, message, all this need to come together for a product or a business to really scale up. But then after a certain stage, we start to realize, okay, the industry has always been evolving, and we should be evolving as well. So now we have so much data. So what can we do? So now become a different kind of like a thought process for like a business model. So can we analyze our data? Can we actually go back and educate certain doctors? Always some doctors who accept this, right? Or insurance company, or employers, and they will be benefited by this. And obviously, another data gap. When they don't know, they look at us blankly, like a pharmaceutical company, like, what can we do? Well, we love what you're doing, but you tell me what to do. So then we have to take the initiative to, do some research or do a, paper whatsoever, really trying to say what kind of value our data can bring to them. We're still in the process to explore this, but what I'm trying to say is that I think that, if you work in women's health, the data gap is always there. It's always with you, but maybe at a different stage of your company and also at a different stage of industry involvement, you will have a different problem with the data gap. And then sometimes you can take it as your opportunity. Sometimes you have to go really strategically work creatively to go around with that, to make sure your business is going to be sustainable?
I would be remiss if I did not mention the book Invisible Women. I know we have all talked about it. If you haven't read it, I highly recommend it. Just know that you're going to be angry, full of rage the entire time you read it. And it really talks about not just where the data gaps are, but by building on top of data gaps, you don't even know how deep that crevice goes. One good example is that women were not required to be included in clinical trials until 1992. I don't know about y'all, but that was in my lifetime. It's wild to think about how much data we're missing. We are not just small men, and it affects everything from the way seatbelts are designed. Who thought this was a good idea for women? Everything from things like that to how the healthcare system perceives what we do. So if you haven't read it, I don't know the author. It's not a sponsored, whatever. I know that comes up for y'all all the time.
All the time. But lots more people are interested in women's health, and the Biden administration in particular has gotten really vocal about supporting and making financial commitments to the women's health space. For Allison and Sonia, I'm curious, why do you think so many more players are stepping into the space and excited about it?
I lost the book. Nice.
So I honestly think it's a generational thing. I'm Gen X, and I will tell you that we just won't take it. We will not accept the patriarchy, diminishing us, marginalizing us, and not funding us. And so I feel like it's finally having its day, and I alluded a lot to mental health. Like back in the day, 5-10 years ago, nobody would talk about mental health with anybody other than their close friends. It would never come up at work. Now there's training programs to help people understand mental health, the implications of it, how it shows in the workplace, and there's support and resources. I think menopause is the next thing, and I think the Biden administration, Jill Biden specifically, really raised this issue and said, all that this panel has been speaking about, that this is underfunded. Historically, we have not had the research and the data required to make good decisions and develop good tools, diagnostics, and treatments for women. So it's not only things like cardiovascular disease, which affect women differently, show up differently, making sure doctors are aware of those symptoms, but also things like endometriosis, which also averages 3 to 5 to 10 years to be diagnosed, and then good luck trying to find someone who can treat it adequately. So I do think this generation and generations that follow mine are just going to speak up, and they're not going to take it, and they're going to stand up for their rights and demand action. And it takes all of us. It takes a village to be loud and advocate for women's health. And I just would tell you all, know your health history. You own your own health, so never go to a doctor's visit without your medication list, your family history. If there's symptoms that are affecting you, track them. And go equipped to only have 15 minutes with that doctor, because our healthcare system, unfortunately, is pretty broken as well. So find the right doctor, go in informed, and advocate for yourself. Don't accept being dismissed, and if the doctor is the right one for you, find another.
100%. Backing up a little bit as well, I think that we're seeing a lot of progress today. We're able to talk about a lot of these things today because this progress comes also on the backs of a lot of pioneers. And I really like the way that Sylvia used the term pioneers. And also just that fact about the executive order that was put through in 1993 from the Clinton administration for telling the NIH, yes, you need to include women. Before that, in 1974, basically, it was a recommendation from the FDA that in early clinical trials would not be included. So without research, without testing and trials, without an understanding of how different people react to various treatments, you can't really have fundamental advancements, right? So we've had other advocates and pioneers, and we are really advancing a lot now because of that work. And I think it's amazing that we can sit on a panel and talk about menopause, and that's cool, we can talk about mental health pretty openly these days, that we can talk about these pieces that just affect women and like be open about these things. And that's really new and amazing. I think that comes from learning and understanding those differences more. For Haven, working on migraine, our company just wouldn't have been possible 5 years ago. And that's because the advancements in the field weren't there. You know, there were discoveries made about CGRP, and that led to massive advancements in medications and treatments for migraine. And that's why since 2018, there have been 12 new medications on the market, and there's 30 more in development. And we wouldn't have been able to put patients on a care journey without that, without the clinicians that we work with going from prior to 2018 saying like, oh, well, we can help people get maybe 50% better, or kind of that kind of range of improvement. Now, like, our clinicians aren't settling for less than 90, 95% improvement. Like, there is so much hope that would not have been there without that research, that effort, those advancements.
And it's really powerful, right? The speed of innovation that's moving, we have the opportunity to make some real changes, but it doesn't matter if the FDA won't approve it. So, on that note, I know, Sylvia. Given that there were so few solutions on the market that can serve as a predicate for FDA approval, I would love to understand how your teams have navigated the regulatory hurdles associated with bringing your product to market, and if you brought on advisors or new hires, and how you're working through that.
Yeah, sure, that's a good question. So when we're doing the rehearsal, this question should be asked more often. I don't think we talk about regulation very often. I think FDA is, compared to other countries' regulation, FDA is relatively open-minded. So I don't want to blame them. But the reality is that usually, especially for stuff we want to do, like it's in women's health, and it's a combination of not just the product innovation, but also business model innovation. You're unlikely going to find a packaging. So that's a problem. And then become everything that you know what you're trying to do here is low risk, and you actually will tell you actually say de novo. So everything is de novo. And then de novo doesn't take a lot of time, and clinical trial, you need a big team whatsoever, and you start to think about, is this really the right path I want to go? You know, with that investment, is this model still going to be viable? So I don't have a solution about how to change that. I think, over the time, after FDA saying, so many cases, we're always in the communication with FDA to tell them, our data, our clinical backup, and the safety, how to manage the risk assessment, all the same. I think FDA definitely has their initiative to evolve, but that part is really slow. So I think as the startup company, what may be a way we could do is that we can test this product in some alternative way before we go to say FDA approval. So I feel like that way has been quite successful for us because before you go to market, you have to go through FDA. And at that time, you actually don't know if your product is going to peak out, it's going to be $1 million product, it's going to be $100 million product or not. But there's always a way, if you think about this. And FDA doesn't like this, say, oh, you cannot really claim this. Maybe you claim with a narrower perspective. You claim with something that doesn't sound that sexy, doesn't sound that creative, but you can pass the market with that. And after your consumer, after your patient time, say, how do you like it? Is this really worth investment or not? I think this is going to mitigate the risk for the company and also manage the resource allocation manufacturing. And also a note on the topic we just talked about on the Biden administration. I think that this is something the entire society needs to work together to really happen. Because women's health, historically you don't have data. So you don't really have the good evidence to show. So yeah, there's some startups, pioneers whatsoever in women's health, but have you seen any blockbuster exit in this industry? Have you seen any blockbuster IPO in this industry? Have you seen any women's health found specifically women's health has seriously nothing? Okay, so why is that? And then people maybe they're suspicious. Oh, why do I want to invest in this? Because you don't have data. If you don't have data, you don't have scientific evidence. Yes, you can do slight improvement on an existing product, but it's not going to be a breakthrough. So the real reason nobody to blame. But where the research should happen? As a company like So we can do some research, but the research should, really should happen in research institute with government funding. Like this, although by the administration, I don't think that amount is sufficient, but there is something at least. So, to happen on that side, and also having in doctors' education, so there will be no more OB to say, looking at the hormones at the same time, this is gonna create my workload because the patient gonna ask a crazy question. Patients are basically stupid, they don't know what you're talking about. So all this needs to change. That's the entire society needs to change. It's not gonna happen overnight, but I think it was like this, and maybe some more successful company gonna show good example, build confidence in the investment or in the more like a IPO market whatsoever, and a little bit of funding over there, and as a consumer you can always voice for your needs to your doctor, and as maybe you want to fund a women's health company, and that's also pushing for an initiative. It's just everyone has to work together, and it's gonna take time to happen.
So for us, we've got a bit of a different because we are not a genetic advice, we are a traditional scientific advice. And there's always I think your regulatory strategy is very tied to both your clinical, but also how you look at your investors. You just can't get around it, right? The best company to make an impact on women's health is a company that is still alive when it gets product out the door, right? So you've got to have enough funding to make your regulatory strategy make sense. As a medical device company, we don't have the option of launching something that hasn't been cleared, and for good reason, right? You wouldn't want a medical device used on you that hasn't been cleared. But we do have to get creative about what it is we clear, how it is we design the product, and how we build that regulatory strategy over time. So for us, we are trying to get our first 510K through the door, right? And we're really trying to keep our product somewhat similar, which is counterintuitive, right? For investors, you want to say, look how new and shiny and different my product is. But for the FDA, what you're really trying to say is, no, this is an incremental improvement with very similar principles and acts very similarly in the body. Both things can be true because the way that we are innovating, the things that we think are really important actually have to do with clinic operations and how what will make life easier for a clinic and a doctor. But we are very cognizant of how we build that regulatory strategy. We have to be careful about what we say, what we put on our website, for example. And you want to strike that balance. And frankly, no one does that by themselves. You don't start a company and submit to the FDA tomorrow, right? You bring on regulatory talent as you need, and you try to bring people on who have gone through that process before. Luckily, we all come, our whole team comes from a medical device background, and we've been through sort of that FDA process, but it is an ongoing tension. We talk a lot about that. The milestone for our next race is getting that FDA submission in through the door. And a note on, because you were talking earlier about FDA versus other regulatory agencies, right? The FDA is a pendulum, and right now it's in a little bit looser, maybe tightening cycle, we'll see. Europe, on the other hand, like 10 years ago when I started in medical device, Europe was like the place you went. You got a CE mark and you launched in Europe, and then eventually you went to the US. Right now it's been completely flipped. Given the new MDR regulations in Europe, no one's touching it. I mean, it's taking 2 or 3 years to get a product cleared, so you've got to be cognizant of what your launch strategy looks like. And sometimes the market changes over time. We're happy to see that the US market is becoming more receptive to medical device innovation in women's health, because that's great news from both a regulatory and market perspective. But that wasn't always the case. Again, 5 years ago, I don't know that we would have had the same company that we have today.
Sonia, I would ask you to see if there's a moment for you to jump off that investor's point. How do you all think about differentiating from an investor landscape perspective?
Yeah, we don't have the exact same dance at Haven because we're not dealing so much with the FDA. It's more of a dance of saying what will payers, insurance companies pay for, and dealing with medical boards and things like that. But it is a balance. How do we make sure that we're doing right by the patients? Also, getting a product or service out there that payers will be okay paying for, and that's a back and forth. And then there's that part about differentiating, how are we neatly set up and capable of pulling off and taking hold of this market. And so, from that payer's perspective, we have the founding team is sitting right there. We have the advantage of having worked together previously in the payer kind of landscape at collective health, and so we kind of know that world. We understand that it very much helps that in migraine, for a patient that's untreated, it will cost an insurance company $8,800 more per patient per year. So that certainly helps. From like the patient, making sure we're doing right by them perspective, in our industry, there is a very serious shortage of specialists. So for every patient, or for every provider specialist, there are about 80,000 patients. That's not super many. So basically, how do we set up a place, having pretty deep understanding of ops and service and healthcare? How do we make this a place where specialists want to work? Whoever wins all the specialists wins the game, because we can take care of those patients. Okay, so there's that piece. And the other part of patients is we also have a deep understanding of like product and experience. We're founded from more of a design and experience standpoint and that deep expertise. So how do we look at this problem from that lens of saying like, all right, how do we take all of those moments where people are kind of at their most panicked or at their most low, make sure that we're solving for those, make sure that we're taking care of those, so that we can work backwards from there and make sure that we're taking care of them along their whole journey and making all of those moments in time really smooth. And then there's just kind of how are we capturing the market? And I think the part that's interesting is like, while this is such a huge problem, I need to look up the number that in my cheat sheet, but like, this is like $120 billion market that's typically overlooked and often by male investors. And it's surprising that you have to kind of go back to the fundamentals of like convincing people that this is a problem that is worth solving, that it is that big, that there are solutions out there and that we can tackle them. Because a lot of times, like when you're talking, and we just kind of found this more often with male investors than female investors, because there are more females with migraine, they know somebody, they have it themselves, they kind of viscerally understand the problem. There's just a lot more explaining to do. They're not as familiar, so they're a little skeptical.
No, we are running up against time, so and I want to leave time for audience questions, so please start thinking, what do you want to ask our lovely panelists? So I'm going to jump forward, and I'm going to ask Allison and Sonia, and for anyone else that might want to jump in. We know that women face bias from the healthcare system while seeking care that can lead to delays in diagnosis and obviously increase the cost of care for women, and so I would ask, what advice would you give to our audience to help them advocate for themselves when they're at the doctor?
Yeah, I'll reinforce some of the points I made earlier. I think first starts with finding the right doctor. And so it's doing your research before you even approach a new practice or a new physician. And check those Google reviews and check the medical board, make sure there's no complaints against that doctor. And in the case of menopause, only about 20% of OBGYNs actually have expertise in menopause. So you need to find a menopause expert. And so there's something called the Menopause Society, it's nant.org. I tell every woman I meet to find they have a directory of care providers, go on there and find somebody who's certified, because that means they have the right menopause education, they took a test to demonstrate that, and they have to be recertified every 3 years. Otherwise, your doctor would not be equipped to treat you. And not to bash doctors, but doctors aren't so good sometimes at telling us what they don't know and referring us to people who do. So it's finding the right doctor. As I mentioned, it's preparing in advance. I know it's a burden, but do your research, educate yourself. Make sure you're aware of the options available for your treatment and the management of your symptoms and long-term care, and go with specific things in mind. What are your treatment preferences? And again, before you visit a doctor, maybe even talk to the office and say, what options does this doctor provide? And what are the qualifications in terms of making sure I can get menopause hormone therapy if it's so required? If they tell you that you have to be tested to verify that you're in perimenopause, walk away fast, because they should be listening to your symptoms. And yes, testing has its place. It's great to make sure you have testing to verify. There's no other disease states or no other health conditions. But if they need to go off of symptoms, and again, it's somebody who's going to give you the time. I always tell people, don't schedule a well-woman visit, schedule a problem visit, because you will get more time. So again, try to make sure that time, and maybe you schedule up a follow-up before you even have the first visit. So if you need to have more attention, you can get it. And I love the fact that we have portals today and we can communicate with nurse practitioners. Nurses, they can often be excellent sources of information, and the doctors themselves. So you're not left stranded for 3 months with something that doesn't work for you and nobody to go to. So use all forms of education at your disposal. Track things in advance, go informed, and then make sure you follow up.
Amazing. All of that. Similarly, there are certified headache specialists. If you have migraine, talk to a specialist. If you feel like your symptoms are overlooked, if you feel ignored, my biggest piece of advice is that your pain is real and your symptoms are real, and you deserve for them to be heard and understood, and for help managing them. And you need the right help to do that. So it's okay to get a second opinion, a third opinion, a fourth opinion. Keep going until you get somebody that will help and understands the problem and takes it seriously. Fun anecdote. So we work with a handful of clinicians, and I've heard from more than one that they would far prefer to do a Botox for migraine type procedures. So this is 31 shots in your head, injections of Botox. They far prefer to do this on women than men. Men are looking for distractions. They put on headphones. They're nervous visibly. They're in pain visibly. Women are carrying on a conversation. We deal with a lot of pain, and we deal with it well. Your pain is real. Take it seriously. You deserve to be heard.
I just want to add to that. I think everyone has to be the driver of our own house. So don't just assume that it's like in last century, doctor is the only person that owns your house. This is not true. It's you. So you are equipped enough with this knowledge, with the background, with the expertise to learn, what is in this house and what works best for you. So that we see. That's also something I learned after I started Mira. I used to think about, women's health or any health condition, ask my doctor. Any question, ask my doctor. It's wrong. And then you will say many things you cannot answer. Like for the patients, for example, we have, right? So they cannot get pregnant. They need to adjust their lifestyle. No one will even tell you how to adjust your lifestyle unless you're in a fertility coaching program. Those are like a nurse or a coach will tell you, okay, your body works as a whole thing. She will talk to you about your sleep, diet, stress management, mental health, family history, whatsoever. So, and you will, adjust, become more aware of your body and adjust your lifestyle, and you feel better. And usually your body works as a whole thing, and the problem you're trying to solve will get better. But if you only seek for doctor's advice or like an OB, unlikely this will be the direct solution for you. So how to get there? After I started Mira, I realized there's so many companies just like us. We're directly to consumer. So we provide so much education. We have free webinars to our users, and we provide coaching, we provide tech support. We even prepared a free ebook so they can download, and a nutritional program, mental support, meditation class just for fertility. So there are many resources. Actually, they're free online. So really know your problem and know they exist. First, they just know they exist. No, you are the only person can make your health knows what's best and works best for you. So seek for this help, and then when you go to see your doctor, tell the doctor this is what you want. Don't let them leave the conversation if you don't 100% agree with that treatment plan or something like this. I think this is more like a comprehensive or holistic approach for your body. Usually works really naturally and turn out to be really well.
And I would add, please talk to your friends and your family about what is happening in your health, because often your mom can be a point of reference for you for what you're going through it, and cultural taboos will have us not facilitate those conversations. So please speak up. Okay, those were all of our questions, so I would love to open it up to the audience. We have a few minutes for you all.
Oh, sorry. One other point I wanted to make about seeing doctors, is that don't be shy. Yes, talking about sexual dysfunction or issues in intercourse is never comfortable. It gets easier, but if the doctor doesn't know, he or she can't help you. We are a little bit of a repressed society, and we don't talk about sexual education, we don't talk about sexual dysfunction, except again when it comes to men. I think there are like 30-something drugs for men's sexual dysfunction, and there are 2 for women. Huh. What is that about? So please share all the information, don't be shy.
Well, thank you all. This has been both devastating and amazing. In an effort to take control of my health, I lived in a few states, I've had a number of jobs, different insurance companies. Where do I go to collect my health records? Because I don't know where to do that. I know they are at Koesterer, I know they are at Kaiser, I know they are here. But where do I go to bring them all into one place?
It's called a spreadsheet. I mean, I literally track every medication I take, the dosage, like frequency, how long, what's what. I know it's painful. But unfortunately, a lot of medical systems don't talk to one another. I experienced this with my mother's family health as well. She had Alzheimer's and a number of disease states. And it was a full-time job trying to connect the dots between providers. So unfortunately, the burden is on us. Great. Unless other people have suggestions.
I don't, spoiler. No, it's absolutely infuriating. Part of it is that the incentives of the system is that everyone wants to own the data, whether that is a company that's building a dashboard or a health system. Nobody wants the data to talk to each other, and that is somewhat by design.
Sure.
Not with the consumer in mind, but on the other side. I think it is, you're right, it's exhausting to track all of your own data. Right now there isn't an alternative, and so for anyone who is interested in starting a company in women's health, you have lots of lessons, and lots of people have tried this over time. I think we will eventually get there. It's just a question of who will do it first. So, Kate, the best thing is
This is really great, and I really love hearing a lot of what you're saying about women versus men's health. But I wanted to hear a little bit about how we're thinking about intersectionality and Black women's health is often ignored, especially with maternal birth rates and trans women's health, and as well as women who live in poverty or don't have health care. So how can, I guess, we be better advocates for one another, but what are things that we should be listening for and learning about?
I'll start. One of the reasons we are building what we are building at Ananya Health is because the rates, even in the United States, maybe especially in the United States, of cervical cancer are much higher among Black women. The state of Alabama actually just became the first state in the country to have its own cervical cancer elimination plan. They launched it last year because 60% of Black women in Alabama who are getting a positive pap smear are not getting follow-up care. This is and I'm not blaming the women here. There are maternal care deserts everywhere. There's a lack of specialists. You would think that OB-GYNs are everywhere. They're not. About half of the counties in the state of Georgia do not have an OB-GYN in the county. And this is for a routine screening visit, right? This is something that you can go get done at any general practitioner. So a lot of what we are building is sort of in that vein of how do we make it easier at the lowest level of care to get screened and treated right away, so you're not traveling 2 hours to the next hospital or whatever. I think, is there a broader answer there? I don't know. I can talk about what we're doing here. It's encouraging to see how much more is happening in that space, how much more inclusive the language is becoming, but we are starting in a hole in the ground, and we're digging ourselves out of it, right? So we've got a long way to go.
So, other interesting facts regarding migraine, while women as a whole, 20% about of women, or a little bit more than 20% of women as a whole suffer from migraine. The stats are a lot higher for bisexual women, and even bisexual men, or gay women than straight women. So I believe it's a little bit below like 90% of straight women suffer from migraine, but closer to 30% of bisexual women suffer from migraine, like something like 27, something in that range. Looking at nods. So it is wild. Like all of these things have an effect on health, and I think part of the benefit of being able to do more migraines is a great case for virtual care. So much of it can be done from the comfort of your home, that you can access great specialists now over video. You can get so many things done. That doesn't mean that you'll never have to get in-person care, right? Like you're not going to get Botox for migraine over, the video screen, or like nerve blocks or things like that. Or like there are certainly transfusions that can be helpful if you're really in crisis. But for your basic care, like our ability to expand access and give people timely appointments and give people care regardless of where they are, it's so much more improved for some of these disease states, at least through virtual care.
We have time for 2 more questions. Go ahead.
It's a little less of a question than just something to share as women and change. I feel like thank you for all the panelists for sharing your stories, your passion. We are advocates for ourselves, and I've just learned that aside from the Biden administration's funding, there will be a women's health pack forming. And so if anyone wants to sign it, I think it'll go around as just a form you can advocate for yourself, whether you're a physician, founder, patient, woman with interest. I think it's time for us to all just be attuned, be educated, and advocate for funding, for research, and all of these causes that are definitely going to be impacting us all.
Hallelujah. Everybody has a voice.
I think you answered some of my questions. I think you mentioned how women's science research is not getting funded. We all know that. I was just going to ask, what is being done? What kind of agency is there for us, and what kind of work is being done that we can change that? I think this is very personal to me. Family member had cancer and they couldn't find treatment for her because there wasn't any research. The doctor said, she's been looking through to see it was a very specific type of cancer that women have. And I was furious. It was infuriating just to see that, that sort of disparity in research and funding. So I would love to learn more or hear more on that. So.
The ones that I know about, we know that ARPA-H there's a $100 million women's health grant, which sounds like a lot of money to some people, and for all of us that raise money for companies, we're like, oh, that's great. That's cute. But probably bigger than that, NIH just, institute-wide, or all institutes-wide, the National Institutes of Health has committed to it. I can't remember the number. I wish I had a cheat sheet. That was so long.
I wish I included it.
Yeah. But, NIH is they've committed to something like $500 million, please don't quote me on that number, over the next 2 fiscal years, increased over what they're already doing. So those are just the U.S. government sources of funding. But, I think a lot of us here as entrepreneurs, we're busy heads down building our companies, right? Like there's, we can go out and look for those opportunities, but there is definitely a sea change that comes from other avenues, from people in this room, from government, from private funders, from family offices, from investors. And I think it was Sylvia that made a really great point earlier. The thing that begets great investment from private investment is exits, right? So as we start to see things like Maiden Clinic, as we start to see women's health-focused companies become more successful, Merck spun out Organon. It was not even 3 years ago. Organon is now a publicly traded company focused entirely on women's health. So we're starting to see those things, and I think, seeing the policy climate change, seeing all of these things take time, but the flywheel is turning. That is not a satisfying answer, I know. Just these are the things that we've heard about in the last couple of months. Just NIH, ARPA-H, and I'm sure there's more. You probably know.
I would add one called Women's Health Access Matters. It's a nonprofit that's bringing a lot of researchers together to try to get better grant funding associated with it, so worth looking them up.
Hashtag WANG.
Yes.
Yeah.
And there's another resource which is university research. So the we become aware that because there's so many universities trying to approach Mira for research opportunity. I don't know exactly where their funding comes from. It's from different sources, but there are many things that are going. Like people want to research on the track cycle pattern or hormone pattern for PCOS, long COVID, how long COVID affects the cycles. And there's even more crazy one, like someone wants to send astronauts to the space and say how the cycle will change over there. They want to use Mira to track. So I never knew those ideas existed before we had these collaborations, but that really opened my eyes. So there's a lot of stuff ongoing over there. But university research is already stage, right? If you think about, I'm a very commercial person, so I think about, when's it going to turn out to be a product or application or a claim? That will take a while, but there are things ongoing over there too.
There's hope.
Yeah, there's hope.
Last burning question.
Thank you all so much. I'm a current student at Berkeley in my MBA and MPH. And as somebody who wants to go into women's health, what strategies would you suggest for coming up against gatekeepers who are now?
Okay. Smash the gate. No, I mean, there will always be people who try to keep you out of things, but there are lots of people who won't, too, right? Like, and I think seeing the growth of FemTech companies and women's health companies here in the Bay Area. A great resource is my co-founder, Julie, who knows a lot of them. There are lots of people who are very inclusive and want people who are passionate about the space. The general advice that I got coming out of engineering school was like, go and learn to build great products and then go find the passion, Like, I'm very grateful that I spent some years just building medical devices in general, because now I have the skill set to sort of take it where we need to go. But, don't discount what that passion is. Keep knocking on doors. Keep going to meetups. You never know where in your journey you're going to have that conversation that sparks something. And sure, there will always be people who are gatekeepers, but, look for the ones who are opening doors.
Yeah, just think about the gatekeeper I talked with, an interview that whole week. If I listened to her, there wouldn't be there, right? So that was like a total roadblock over there. But I think now it's different than a few years ago. So we have women's health days, we have really many women's health or women's innovation or tech association. Like this Wing is a great organization, and there's also think tank insights and some others. They have a huge Slack channel with many people sharing the same passion. And it's really nice to go there to look at and say, oh, actually we're doing this kind of thing, that kind of idea. So we'll give you a lot of insights. There's always going to be whatever you want to do, even if you just go for a different career, there will be people saying no. They know that this is not going to happen, but you have to make your own decision. And if you want to start a company, I think the obviously most important thing is business model. Is there really a need from the who is your clients and for the customer who's going to pay, and is there really a viable business model, and how do you test that? And then you need a whole bunch of resources. It feels like at the beginning, it feels like you need the whole world, all kinds of expertise you've never done this before. Work together, synchronize together to make that happen. So I think if you put the right resources together, you make the right strategic direction, yes, it will happen. But it will be a you have to navigate through that.
FemTech Insights is a great one to follow.
Yes.
They have newsletters, webinars. There's also a Slack channel, and there's wonderful advice and counsel that is provided in the Slack channel, and anybody can really participate. So that's a great one.
Yeah, there are many webinars too.
FemTech Insights.
FemHealth Insights?
Is it FemHealth or FemTech?
They're probably both of those.
Okay, maybe both.
Are fantastic.
There's
Yeah.
also Women in Health Tech. That's one that's New York based, but they have like San Francisco meetups and similar like newsletters and awesome resources as well.
And many have online events, and they're free, or like a few dollars for to go to event. You may just listen to the other company's pitch, and you would say, oh, what's going on in there? What could be working? What could be maybe not working? So there's a lot of resources over there. You just need to find the right community to go to.
On that note, before I release us all to continue asking questions of each other and giving amazing answers to each other, I would love to thank our panelists.